Hi, I'm Dr. Athena with Tele-PT Physical Therapy, and I'm going to talk about diaphragmatic breathing today. Just a basic overview, right? So I'm going to set you up right here so you can see my dry erase board. Okay, so we're going to get started. This is the diaphragm right here, this pink muscle, and above it rests the lungs, both right and left, and the heart. When it's in the inhale position, it creates a negative pressure, draws the air in to the lungs, both lungs. And when it drops, it massages the stomach, right? So we've got here, this is its exhale position, and when it drops, it massages the stomach, it flattens it. So do you think diaphragmatic breathing helps with reflex? Absolutely. How? Because when the diaphragm is above the stomach, as it's going down to breathe and doing that repetitively, it is massaging the contents of the stomach downwards, bringing air in, creating that negative pressure, even assisting with drawing blood back into the heart. Yes, diaphragmatic breathing can improve your cardiovascular health. So we're drawing the air into the lungs, the diaphragm drops, massaging the stomach and the intestines, which improves overall intestinal mobility. This can be a huge game changer for people who have been anxiously making it a habit of breathing through their chest. It looks like this. There we go. Okay, instead of this, I use diaphragmatic breathing most of my day. I use it in my workouts. I use it after I eat. If I'm feeling like I've had something sour or I'm tending towards reflux, I will absolutely start focusing on breathing with my belly. How do you know whether or not you're doing it right? Some people think that they breathe with their diaphragm, but they're not. They're breathing with their chest. So I'm going to just give you a little way to find out how you're breathing. So put a book, this is a magazine, but put a book at your belly and then put that book up against a wall. Now, if you're able to breathe and push your body away from the wall with your breath, with the magazine resting just about your belly button, that's a good sign that you're diaphragmatic breathing correctly. Well then, how do you make it an important part of your day, a habit every single day? So that's something I've been working with my patients with. And what they do is they choose one or two things that they do every single day, repetitively. One of my patients, she does a lot of drying hair. So every time she dries someone's hair, she is practicing her diaphragmatic breathing. Another one of my patients, she sits at her desk and it's kind of her time to focus in on herself. She's not talking with other people and she practices her diaphragmatic breathing. So in that way, the body can start forming the reflex. Right now, people, if you're breathing through your chest, it's your reflexive action. It's your habit. And so to change that habit, you've got to start practicing and being focused and mindful with your diaphragmatic breathing. When you are using that muscle more often, One of my patients said it was time for me to work on my breathing, my diaphragmatic breathing, and I realized I was already doing it. And that is what can happen with your, as you practice, your body will kind of get that muscle memory is a common way, or that reflexive action. It will know that's what you want to do in that time or in that situation. And so I've been using it more and more in my workouts. And I have found that I can really get more oxygenation, I guess is what's happening, and possibly more strength. What I do is I breathe deep with my diaphragm, and then as I exhale, I will also do like a quick little pelvic floor contraction right here. And so it stabilizes my abdomen. And of course, the bowl-shaped muscles are contracted as well. So everything is very functional in pelvic floor physical therapy.